The following videos are a demonstration of the basic skills required to care for a child with a tracheostomy. Now, this is not meant to replace hands-on training, but to provide an additional resource. A wet washcloth, a dry washcloth, and soap. Acceptable recommendations would include Dial or Cetaphil, nystatin powder, a blanket roll, drain sponge or other barrier, scissors, trach ties, and trach to-go bag. Measure and cut the replacement tracheostomy ties. Measure the distance around the child's neck between the tracheostomy tube flanges. Include enough room to allow one finger to pass easily under the trach tie. Position the child so his or her head is slightly extended and the stomach is visible and easily accessible. Place a blanket roll under the child's shoulders. Determine who will be holding the trach during trach care. To change the ties, hold the tracheostomy tube and have the assistant remove the trach ties and the drain sponge and the barrier. Perform a complete assessment of the skin around the circumference of the child's neck. Clean the child's neck with soap and water and then rinse. Allow the skin to dry completely. Pat dry if necessary. Apply nystatin powder to trach ties or skin as indicated, but do not shake directly around the stoma. Thread the new trach tie through the flange on one side of the trach, and then repeat on the other side of the trach. Place a new drain sponge or barrier as indicated. Bring the ties around the neck and secure the Velcro. Checking each side of the neck separately, place one finger between the ties and the neck. Readjust the ties to an acceptable tension if necessary. The caregiver holding the trach may now let go of the tracheostomy tube. These videos are available for you to review as often as you would like. If you have any questions about any of the skills shown here, please ask a member of your healthcare team.